When I saw my specialist and she described what was going on with me, and she actually even showed us pictures of my heart from the echocardiogram, what she emphasized was the right side of my heart was so very enlarged. It was working so hard. She just assured me that as hard as my heart was working, we have to get this under control now, and that it was the IV Remodulin that could do that for us, that the oral medications were probably not going to work quickly enough. So if you're thinking, or your doctor is advising Remodulin IV, I would say have a really good talk with your doctor. First thing is, what are your goals? And make sure that your doctor knows that, whatever it might be. And ask your doctor, what are the goals that he or she has for your particular treatment plan, and what does IV Remodulin do in that treatment plan? Why is that the treatment? I think that understanding what's actually going on and what we hope it can lead to really helps to say, yeah, this is something that I can try. Some folks who know about Remodulin or other IV, they call it sort of the big guns, that it's the last medication that doctors use. And I would say, no, it's actually not. It's certainly more of a management issue. It's certainly more invasive than popping pills, but it's a very effective treatment of care that, in my case, I was put on right away. It can be tough at times to manage, but it is very doable if you have the training and the support to manage it. It's not for everybody, that's true, but medications have to be tried to be found effective, and it's worth really looking at. It's worth trying if that's what your doctor thinks is best for you. It's been remarkably positive for me.
Remodulin treprostinil injection. Indication, or what is Remodulin? Remodulin is a prescription medication used to treat adults with pulmonary arterial hypertension, PAH, WHO Group 1, which is high blood pressure in the arteries of your lungs. Remodulin can reduce symptoms associated with exercise. Remodulin was studied mainly in patients with NYHA functional class 2 through 4 symptoms. It is not known if Remodulin is safe and effective in children. In people with PAH who need to switch from epoprostenol, Remodulin is approved to slow the worsening of symptoms. Important safety information for Remodulin. Before you take Remodulin, tell your healthcare provider if you have other medical conditions or take other medicines that may affect your use of Remodulin by increasing the risk of side effects or decreasing the drug's effectiveness. Have liver or kidney problems. Your Remodulin dose may need to be adjusted if you have liver problems. Have low blood pressure or bleeding problems. Are taking gemfibrozil for high cholesterol, rifampin for infection, or other drugs that affect liver enzymes. Your doctor may need to adjust your Remodulin dosage. Are pregnant, breastfeeding, or planning to become pregnant. It is not known if Remodulin will harm your unborn baby or if Remodulin passes into your breast milk. What are the serious side effects of Remodulin? Continuous intravenous IV infusions of Remodulin delivered using an external infusion pump with a tube placed in a central vein within the chest are associated with the risk of bloodstream infections and sepsis, which may be fatal. Therefore, continuous subcutaneous SC infusion delivered just beneath the skin is the preferred type of delivery. Worsening of PAH symptoms. Do not stop taking or greatly reduce your Remodulin dose without consulting your doctor. Low blood pressure. Symptomatic hypotension. If you have low blood pressure or are taking drugs that lower your blood pressure, the risk of low blood pressure is increased. Bleeding problems. Remodulin may increase the risk of bleeding in people who take blood thinners, anticoagulants. What are the possible side effects of Remodulin? In clinical studies of SC infusion of Remodulin, most people experienced infusion site pain and infusion site reaction, redness, swelling, and rash. These symptoms were sometimes severe and sometimes required treatment with narcotics or discontinuation of Remodulin. IV infusion of Remodulin delivered through an external pump has been associated with the risk of bloodstream infections, arm swelling, tingling sensations, bruising, and pain. The most common side effects seen with either SC or IV Remodulin were headache, diarrhea, nausea, rash, jaw pain, widening of the blood vessels, vasodilation, and swelling from fluid retention, edema. These are not all the possible side effects of Remodulin. Call your doctor for medical advice about side effects. You may report side effects to the FDA at www.fda.gov/medwatch or call 1-800-FDA-1088. The risk information provided here is not comprehensive. To learn more about Remodulin, talk with your healthcare provider. Please see full prescribing information at www.remodulin.com or call customer service at 1-877-UNITHER, 1-877-864-8437.